everyone, so let's move towards our today's topic, which is this lecture is basically the part 3 of the nose lecture. Okay, now we have already talked about conchi, we have already talked about the walls, we have already talked about the borders of the nose and introduction as well. Now in this lecture we will gonna talk about the blood supply and the nerve supply of the nose. But before starting that, I have to tell you one thing. It is very important for you as a medical student that you have to know that how it is basically happening. The point is, you have to remember this, that the posterior part of the nasal cavity is basically connected with the pharynx, and that area is also, you can say that, nasopharynx, okay, which is connecting the nasal cavity with the pharynx. Okay, pharynx consists of 3 parts: laryngopharynx, oropharynx and nasopharynx. Okay, the part which is connecting which is near the nasal cavity is called as nasopharynx. Now nasopharynx consists of a tube called as eustachian tube, and that eustachian tube is directly connected with the middle ear. Okay, when you will listen the lecture and when you will attend the lecture of the mid ear, you will know that what is middle ear. But ear is basically, you can say that inside ear there is an area, there is an structure called as middle ear, and that middle ear is connected with the eustachian tube, and the eustachian tube is connecting the middle ear and the nasopharynx. So basically our ears are connected with the nasal cavity. You can also have the concept of this thing. Now we will move further. The blood vessel, the blood supply of the nose. For this you have to remember some very important points, and it is very easy if you will listen this lecture. Be attentive, because I am telling you the most important thing to memorize the blood supply of the nose. For this you have to divide the anterior part and the posterior part of the nose into superior and inferior part. Now what happens when you will divide these parts, that there will be 4 parts of the nose: antero-superior part, posto-superior part, antero-inferior part and posto-inferior part. Okay, now each part, which I have told you that there are 4 parts, so each part is supplied by one artery, and you have to remember that one artery, okay, or one branch of that artery. Okay, now what happened, and you can easily memorize it. The antero-superior part is supplied by ethmoid artery. Okay, now ethmoid artery, आपको ये याद रखना होगा कि ethmoid artery antero-superior part को सप्लाई करती है. अगर आप ये याद नहीं भी करते तो आपको खुद ब खुद याद हो जाएगा अगर आप रिमेनिंग 3 पार्ट्स याद कर लेते हैं. अब रिमेनिंग 3 पार्ट्स का शॉर्टकट है, and that shortcut for the remaining 3 parts are antero-inferior. Now listen to me carefully. The antero-inferior, that means the anterior part, the inferior part of the anterior area of the nose. Now inferior, as you know, inferior means the base or the floor. Okay, and the artery, the name of the artery is labial artery. Now labial artery, as you know, that if I say someone can that to please lay down on the floor, so it will he or she will lay down on the floor. Okay, that is, like I said, the floor is on the inferior side. Okay, inferior, base, floor, ये सब एक ही चीज़ है ना, ये सब इनका मतलब नीचे होता है. ठीक है, तो ले बायल, ले डाउन, you have to remember the labile artery. The word labile is you have to remember that artery with the lay down word. Okay, so labile, lay down, and if I say you to please lay down, you will be lay down on the floor. Okay, you can't be lay down on the in the air और रूफ पे तो आप ले डाउन हो नहीं सकते. ले डाउन, डाउन का मतलब तो यही होता है ना कि आप ज़मीन पे लेट जाओ. छत पे तो कोई नहीं लेट सकता, छत पे भी ज़मीन होगी, उस पर छत पर जाकर आपको ज़मीन पे लेटना पड़ेगा. ठीक है. नाउ एंट्रो सुपीरियर, like I said, ethmoidal arteries will supply. Entro inferior, labile artery will supply. Now posterior part, posterior area of the nose, like I said, you have to divide it into two parts, posterior superior and posterior inferior. Now P for posterior part. Okay, like I said, it is the posterior area. So P for posterior and P for palatine artery. Now one thing you have to remember, that palatine artery will supply the posterior part. That means posterior superior को भी palatine artery supply करेगी and posterior inferior को भी palatine artery supply करेगी. Now which artery, because palatine तो है लेकिन उसका कुछ और नाम भी है, वो नाम आपको स्पेसिफिक याद करना है. तो वो नाम आप कैसे याद करेंगे? that name, for to memorize that particular name of that palatine artery, you have to remember that posterior superior. Now the word is posto, P for posto, P for palatine. ये बात तो कंफर्म हो गई दैट पैलेटाइन का वर्ड पैलेटाइन आर्टरी तो है. आगे क्या आ रहा है? पोस्टो सुपीरियर. सुपीरियर एस से आता है, सुपीरियर एस से आता है और स्फीनो भी एस से आता है. सो इट विल बी ईजी फॉर यू to remember that posto-superior part of the nose will supply by sphenopalatine artery and the posto-inferior part of the nose will supply by greater palatine artery. Now how will you remember this? अगर आपको पोस्टो सुपीरियर याद हो गया तो पोस्टो इन्फीरियर याद करना तो आपके लिए मुश्किल ही नहीं है, क्योंकि आपको ये तो पता है कि पोस्टो इन्फीरियर है और P फॉर पोस्टीरियर एंड P फॉर पैलेटाइन. तो पैलेटाइन आर्टरी तो है. अब या तो स्फीनो होगी या पैलेटाइन या तो स्फीनो होगी या ग्रेटर पैलेटाइन आर्टरी होगी. अब स्फीनो तो सुपीरियर में आएगी तो बची क्या? द रिमेनिंग इज the remain artery is basically greater palatine artery. Okay, now this was the arterial supply. Venous supply is through the the venous drainage is through the plexus, which is formed by the facial vein. And if I told you and if I tell you about the nerve supply of the nose, so the nerve supply of the nose is basically through the trigeminal nerve or the cranial nerve number 5, and obviously the olfaction process, which is also under the part of the nose, so it is through the olfactory nerve, which is the cranial nerve number 5. So overall the nerve supply of the nose is through two nerves, trigeminal nerve and the olfactory nerve. So this was the whole topic. You have to remember. Till then, work hard, study hard, and good luck. Take care. Bye.